Good morning. I want to thank everybody for coming. Please come have a seat. So welcome and thank you all for coming. And most of all, I think Ziv is recruiting people in, but it's such a fantastic meeting, and we're so grateful to Ziv for setting this up. So I've been told we have a teeny bit of leeway time-wise, but we'll try and keep things pretty much on time this morning. So I want to introduce the first speaker, Celine Galvagnion from the University of Copenhagen, and she'll be talking about lipidomic profiling reveals shared pathologic signatures in sporadic PD and GBA1 mutation carriers, implications for disease mechanisms. So, Dr. Galvagnion.
Thank you very much for this kind introduction. So I think I need the two microphones. So I'd like to thank the organizers, Ziv and Lorna, for giving me the opportunity to present to you these unpublished data. It's such a great pleasure to present them to such an expert audience, and I look forward to hearing your thoughts on these results. So we are interested in understanding the role. Better? Yeah. The role of lipid in Parkinson's disease for several reasons. First of all, as you know, lipids are found in Lewy bodies, the protein and lipid inclusion found in the brain of patients with Parkinson's disease, and so it's not yet known why and how they end up there, and how they contribute to the toxicity associated with the formation of those Lewy bodies. Then it is now well established that the disruption in the level of specific lipids, sphingolipid, cholesterol, fatty acid, has been associated with changes in the level of oligomeric, total, pathological alpha-synuclein in a range of cellular, animal model of Parkinson's disease, and also in patient-derived samples. So of course, GBA mutation is a very relevant risk factor for us in our quest to understand the role of lipids in Parkinson's disease, because GBA mutation leads to a decrease in GCase activity and or protein level, which in turn leads to the accumulation of lipid, not only sphingolipid, but also ganglioside. And this is associated with increased level in alpha-synuclein. And so what we and others want to understand is what is the interplay between these three partners in crime, GCase, lipids, and alpha-synuclein. So what I would like to present to you today is some recent lipidomic analysis, and actually also biochemical analysis of different sample. We look at sporadic cases with disease duration from 5 to 36 years, and we also look at PD-GBA cases with the three different types of mutation: severe, mild, and risk. The idea was to understand changes in the lipid profile of amygdala brain sample associated with disease duration and with each of the disease of the GBA mutation. So I'll start with the sporadic cases. So here we determine, among other things, GCase activity in those samples, and we found that GCase activity doesn't decrease in a linear manner with disease duration, but more in a step-like manner. And we saw that for the cases with disease duration more than 30 years, we found a 50% decrease in GCase activity compared to the cases with a shorter duration, which was less than 30 years of duration. So I will present then a result when we compare protein and lipid level for these two categories, sporadic PD cases with long PD duration, more than 30 years, and cases with short PD duration, which is less than 30 years. So we found that not only GCase activity, but also GCase protein were decreased by approximately 50% in long PD. And we found that this decrease in GCase activity and protein level was associated with increase of exosylceramide, which is the mixture of galactosylceramide and glucosylceramide. So we didn't look only at the substrate of GCase, but we also look at the full lipidome by doing a shotgun lipidomic, and we found that the level of many lipids actually were affected due to this decrease of GCase activity. And we found that not only all the sphingolipid level were increased, but also those of the total lipid level, cholesterol, most of the phospholipid, and diacylglyceride. And only for cardiolipin, we saw that the level were decreased in association with long PD, which might point to a link between decrease in GCase activity and some disruption in the health of mitochondria. So we then dig a bit deeper into what was long PD, or how long PD were affected the chain of each of those lipids. And here you can see a graph showing the species of exosylceramide ranked based on the number of carbon in their hydrocarbon chain. And you can see that long PD lead to an increase in the level of the relatively short chain exosylceramide and a decrease in the level of the relatively long chain exosylceramide. The same was observed for diexosylceramide, but to our surprise, the opposite was observed for sphingomyelin and ceramide. There, long PD was associated with a decrease of the relatively short chain species, and it leads to an increase in the relatively long chain species. So we then tested correlation between lipid level, GCase activity, and phosphorylated alpha-synuclein, and this is the result for exosylceramide. You see that the level of exosylceramide correlate negatively with those of GCase activity. This is significant, and the level of exosylceramide correlate positively with the level of phosphorylated alpha-synuclein. Of course, we did this correlation for all the lipids that we detected, and again, as you see, not only the sphingolipid all correlate both negatively with GCase activity and positively with phosphorylated alpha-synuclein, but this was also observed for basically all the lipids that were whose level were affected by long PD. So this is very strong evidence pointing towards a correlation between GCase activity, phosphorylated alpha-synuclein, and lipid level. So then I'm going to show you what we found for GBA carrier. So here we again look at GCase activity. We found that it was approximately 50% lower in for GBA risk, mild and severe, compared to the sporadic PD cases with disease duration match. And we found that that only for GBA risk, this decrease in GCase activity was associated with significant increase in the level of exosylceramide. Again, this is the heat map showing the log2 fold change in the level of all the lipids that we analyze when we compare each of the GBA mutation with the sporadic cases with disease duration match. And you can see that only for GBA risk did we observe significant changes, and it's the same changes that we observe associated with long PD. So for us, for this result, the lipid signature of GBA risk is the same as the lipid signature of sporadic long PD, which was actually pretty surprising for us. We see that for the GBA mild, the trend is the same in terms of lipid variation, but for severe, it's the opposite. So this is also something that we were quite surprised. So you can see that each GBA mutation has its own lipid signature. Again, we look at the lipid chain, and for GBA risk, we observe the same changes as the one we observe for long PD. We observe that GBA risk leads to the increase in the level of relatively short chain exosylceramide and diexosylceramide, and the decrease of the relatively long chain for these two sphingolipids, and the opposite was observed for sphingomyelin and ceramide. So same as for long PD. Then for GBA mild mutation, less species has significant differences, but for those where we saw significant changes, they were in the same direction as for GBA risk and long PD. But for severe mutation, which is shown here, so again, fewer species had significant changes, and for those where we observe significant changes, it was in the opposite direction as the one we observe for mild and risk. So to conclude, our data, biochemical and lipidomic analysis show that long sporadic PD and GBA risk and mild mutation lead to the same changes in lipid levels and and changes in their chain, where we see that the changes are relatively low for mild GBA, but very high for risk GBA and long PD. We also found correlation between changes in the lipid levels and those of disease activity and phosphorylated alpha-synuclein. So again, these three components are highly correlated. And then we found, surprisingly, that GBA severe mutation leads to changes in the lipid profile that were in the opposite direction as those for the other GBA mutation and long PD. So I'd like to thank the group, and especially Frédéric and Sonia, who led this work, and our collaborator and the Danish Foundation for their support. And thank you for your attention.
Wonderful. So if we have time for maybe one question, Ellen?
It's actually two parts. First, did you look at normal patients over the same amount of time?
Yes. And their level
as a sporadic, because there is some reports that with aging, your glucose repersodase levels go down. So I'm not sure if that's
we compare. Yeah, we look at this actually last month. We got the result, and their level are close to those of the short disease duration.
So then you're just reflecting aging. Then I mean, you're saying the same results of a normal person 30 years later is the same pattern as sporadic.
Yes, exactly. So we found the same lipid levels for those.
So it's probably not Parkinson disease related.
Well, you need to have the disease for a sufficient long time to see the decrease in the level of lipids.
Okay. And then were you saying that the lipid accumulation is higher in the E326K variants than it is in the L44P variant?
Yes.
A little counterintuitive, but...
Exactly. I mean, we were also surprised. Yeah.